Hi, everyone, and welcome to Detox, a podcast by Ajanta Pharma, where we dive into meaningful conversations about diabetes and overall health. I'm your host, Kavya. Whether you are a patient, caregiver, or a healthcare professional, this podcast is here to inform and inspire. Today, we are honored to be joined by a leading expert in diabetology, Dr. Anu Gaikwad. We are thrilled to have him with us. Can you start by introducing yourself?
Yeah, thank you, ma'am. I'm Dr. Anu Gaikwad, a physician and diabetologist. I am professor and head of the Department of Geriatric Medicine at Dr. D.Y. Patil Medical College, Pimpri, Pune. I am having my own 25-bedded hospital diabetes center where under one roof, diabetes and related complication can be managed very nicely since long time at Bhosri in Pune. I am very happy to serve the diabetic patients since long time.
Thank you for that introduction, Dr. Gaikwad.
Yeah, basically, let me tell you, diabetes means there is a increased blood sugar level. Either it is because of non-production of the insulin from pancreas, or insulin is produced but it is not working properly. That is called as insulin resistance. So that is diabetes. So what happens in type 1 diabetes? There is a because of autoimmunity, the insulin is not produced at all. So this usually occurs in childhood, in children, young children, and it is called as type 1 diabetes. These children's, they need to take insulin externally for lifelong because there is no insulin production. And type 2 diabetes is that where there is insulin is there up to some amount, but it's not working properly. There is the body is resistant to the insulin, so that's why the blood sugar levels are increased in type 2 diabetes. These type 2 diabetes patients, up to some time, they can be managed on the oral medications, but at some stage of the life, they again need insulins. And type 3 or basically gestational diabetes. Gestational diabetes is a diabetes where in pregnant ladies there is a blood sugars are increased because of some hormonal imbalance or insulin resistance, but it occurs in the pregnancy only. There was no diabetes in the before the pregnancy, and such gestational diabetes which occurred in the pregnancy, up to 50% ladies they will reverse spontaneously after delivery, and 50% they will continue as type 2 diabetes. Lifestyles, basically being overweight or obese, and then no physical activity or exercise, having some addictions like smoking, and then unhealthy food habits, eating starchy foods or sugary drinks, inadequate sleep, as well as having lot of stress. All these things, they are basically responsible for um, uh, diabetes. These habits are responsible for diabetes. Diabetes per se, many of the patients may not be having sign symptoms. They directly present with some complications, but commonly certain sign symptoms like going to frequent urination, then having a lot of thirst, or increased hunger for the food, and then having recurrent infections either at the genital area or the scalp, and then delayed wound healings, unexplained weight loss. That is also a very important symptom in the diabetic patients. And patient may feel generalized weakness, and the complications diabetes symptoms like blurring of vision, even some patient go for blindness, or if there is neuropathy, patient will have tingling numbness in the feet. These are the very common sign symptom in diabetes. But as I told you, remember, you have to remember a very important thing that many patients they may not have any sign symptoms. So we have to check regularly for the diabetes. It's a very common question because the many patients and relatives they are worried about this. Ki Baba, my father, my mother having diabetes. The doctor, will I get diabetes? Or some relative is having diabetes. So will I get diabetes? So we have to remember that if the relatives they are having diabetes, it's not necessary that person will have diabetes. But there are increased chances of getting diabetes, and that can be prevented by having healthy lifestyle, like good healthy diet, exercise, stress management, all these things that definitely prevent from getting diabetes. Diabetes management, one should have a goal that ki, Baba, I should have near normal sugar. It means that I should not have any complications, and then I should enjoy my normal life. That are the important goals in diabetes management, and that can be very easily achieved by the by keeping healthy lifestyle, like healthy diet, means getting non-starchy vegetables, lean proteins, doing regular exercise, managing stress, no addictions. So it can be these goals can be achieved by this.
Dr. Gaikwad, it's been a truly enlightening conversation. So, as we wrap up, what's the one key takeaway you'd like to leave our listeners with?
Yeah, basically, I would like to give a message that see, every person loves his family. If you want to help the family, but if a patient is having diabetes and if he gets some complications of diabetes, you know that very dreaded complications like renal failure, heart attack, then patient needs bypass or stenting, and renal failure patient needs recurrent dialysis, then he has to go again and again to the hospital. But I would like to give a message by this podcast that every diabetic patient should take care of his diabetes and prevent complications, so that he need not to go to the frequent to the hospital, and that will be very important or very good help to his family, so that by this way he can love his family. So take care of your health and be diabetes free. Thank you.
We are truly grateful for your time, Dr. Gaikwad, and the knowledge you shared has been very informative. And I'm sure our listeners have gained a lot from this conversation. And thank you to everyone listening to Detox, brought to you by Ajanta Pharma. Stay tuned for more expert led conversations. Thank you.